We are talking about the limb bone. Now, when I talk about limb bone, basically we have two important parts here. One is called as hand, and another one is called as leg. So hand is basically the upper limb. We have two hands. In each hand there are 30 bones. So total 2 into 30 is nothing but 60 bones. When we talk about the lower limb, that is leg. So again 2 into 30. So we have 30 bones present in each leg. So if I draw a typical hand bone, basically that will help you to understand more nicely. It's like this is your hand bone. So this is the first one, that is called as humerus. Then down we have two. One is called as radius and another one is called as ulna. Here near the wrist, we are going to have 8 basically bones. They are called as carpals. Then we have 5 metacarpals. And then there are phalanges. In thumb, there will be only 2. And in other fingers, there will be 3 bones. So like this, when we calculate, we get total 30 bones. So let's take it in this way. We have humerus. 1 into 2 means in one hand there will be one humerus and there are two hands, so 2. So we have radius, we have ulna, that is 1 into 2, then the ulna. Then there are carpals. How many carpals are there? Total 8 carpals. So these all small bones that you can see, they are called as carpals. There are 8 carpals present. We have to know the names of 8 carpals. Then we have the metacarpals, that is 5 into 2. So here you count, there is 5, and phalanges is 14. How 14? Because in each finger there will be 3. So 3 into 4 will be equal to 12. But in thumb there is only 2. That is why it is 2. So total you get 14 phalanges. So when you calculate all this, you will get 60 bones present in the upper limb. When you talk about leg bone, the longest bone and the strongest bone is the femur. See, femur is the longest and the strongest, but not the hardest. The hardest substance that is present basically in our human body is enamel. So enamel is the hardest substance. Then we have tibia. There will be so femur. Then there is tibia and fibula. So if I draw this, the big one, basically I can call it as femur. Then we have the tibia. Tibia will be fat one. Then we have fibula, a very thin bone, that is called as fibula. And then we have tarsals. So how many tarsals are there? There are 7 tarsals, 7 to 2. Then we have metatarsals. How many? So there will be 5 metatarsals. And in those metatarsals, you are going to get the phalanges. Most important is here. On the knee, there is one special bone present. This bone is called as patella. This is kneecap. So we have fibula 1 into 2, tarsal 7, and metatarsal will be 5 into 2, phalanges will be 14, patella is 1. Here is very important part that we need to understand, that this patella is responsible for providing attachment to the femur and tibia and fibula. Let's talk about the next one. How many carpals we mentioned? So we said 8 into 2. There are 16 carpals. How many tarsals? So we said 7 into 2. That is 14. The 8 carpals are scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. Again, scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. Then we have talus. So the tarsals are talus, calcaneus, navicular, median cuneiform, intermediate cuneiform, lateral cuneiform, and cuboid. So it is talus, calcaneus, navicular, median, intermediate, and lateral cuneiform, and C is for cuboid. If I have to remember these carpals, I have to make a sentence. So the sentence that I can put for carpal is, she looks too pretty. She looks too pretty. Try to catch her. If I make this sentence, she looks too pretty, try to catch her, you will get the carpals. Scaphoid, lunate, triquetrum, pisiform, trapezoid, trapezium, capitate, and hamate. So this shortcut to remember carpals. Talus, I can say tiger, cubs, need milk. So I say MILC. Tiger cubs need milk. Tiger is talus, C is calcaneus, N is for navicular. Then milk is median, intermediate, and lateral cuneiform. And finally, C is for cuboid. So if you know these sentences, you can easily remember the shortcut to remember the tarsals and the carpals. So the shortcut that we discussed just now, she looks too pretty, try to catch her. This is one sentence to remember all the carpals. Or even if you can remember, want, you can try Sam likes to push the toy card hard. That is also a sentence. Tiger cubs need milk is for all your tarsals. Or even you can put it in this way. The circus needs more interesting little clown. No matter what, but you can easily remember the name of these tarsals and the carpals in easy way. Let's see with respect to diagram. This is humerus. Humerus is nothing but it is the hand bone. So I can say this is the uppermost hand bone, humerus. Humerus, when you look at it, it is not straight, it has some bend. The notch that is present is the lesser tubercle, then we have greater tubercle. There is a bicipital groove. Now this groove is going to basically fit somewhere in the scapula. Scapula is the triangular bone girdle. Then we have coronoid fossa, medial epicondyle, then trochlea, capitate, capitulum, lateral epicondyle, and radial fossa. From here, there will be radius and ulna basically attached in the humerus. So let's talk about this. So this part is the radius and this is ulna. Ulna has a very special process here. There is a bend here. So this process is something like this. So this process that you can see here, it is called as olecranon process. And this olecranon, below that there is a coronoid process. This is the head of radius and ulna. In between there will be introssus membrane present. Very important part, there is introssus membrane present. Then at the end there is a styloid process of radius and styloid process of ulna. These process they are going to articulate with the most important part, that is the carpals. There are 8 carpals present. So all the 8 carpals, they will interact here. Now let's look at this one. The carpals. How many carpals are there? So we mentioned that total there are 8 carpals. So we can say there is 1, 2, 3, 4, 5, 6, 7 and 8. There are 8 carpals present. These are metacarpals. So how many carpals? 8. How many metacarpals? 5. Phalanges. So this is the thumb basically. And when I look at the thumb, I can see that there are only 2 phalanges present. So thumb is going to have 2 phalanges. Rest all fingers will have 3 phalanges. That's why when you bend your thumb, you can bend at only 2 places. But when you bend your fingers, you can bend it at 3 places. So remember, this is all what you should know about carpals, metacarpals and phalanges. Then we have the longest leg bone. So I can say it is the longest bone of our body. It is the strongest bone of our body. But remember, it is not hardest. The hardest substance that is present basically is nothing but it is enamel. Enamel is the hardest substance that is found. So it has trochanter, greater trochanter and lesser trochanter. The depression, the bend, this area is trochanter. There is a head. So head is basically going to fit in the acetabulum cavity of pelvic girdle. So it fits there and finally the leg is able to move. When you look at this structure, it is not straight. It is having some kind of curve. And this middle part is called a shaft. There is lateral condyle and medial condyle. To this condyle, what will be attached? The tarsals. And tarsals are 7 in number. So this is femur, longest and the strongest bone. When I talk about the medial condyle, now this is tibia and fibula. There is a medial condyle, the one that will connect to the middle part. There is a lateral condyle on the sideways. Then remember for tibia, T stands for thin, but it is not thin. It is the fat bone. Fibula, F stands for fat, but it is not fat, it is thin bone. So just opposite of this. So we, and in the center you are going to get this introsus membrane present here. So you have this as tibia and this as fibula. There is lateral malleus and median medius. So this is what you should know. When we talk about this tarsal, this is a mistake here. Tarsals are not there. Here what will be present at the bottom? So I can say at the bottom there will be the attachment for tibia and fibula. After this we have this tibia and fibula, and here you are going to have the tarsals, the 7 tarsals that are present. So here you got the tarsals. After this we talk about the tarsals. So remember, tiger cubs need milk. So talus, calcaneum. Calcaneum is the heel bone. Then these are all the tarsals, basically 1, 2, 3, 4, 5, 6. We have median, intermediate, and lateral cuneiform. And finally, we have the last one that is called as cuboid. These are all talus. This is the metatarsal. And finally, we have the phalanges. In the phalanges, remember, the thumb is going to have only 2, but rest all will be having 3 bones present. This is metatarsals, tarsals, and the phalanges. The most important patella. Patella is also called as kneecap, and this kneecap is responsible for giving, you can say, protection or joint formation, and the joint that is formed at the knee will be basically called as hinge joint. Now let's name these parts of the skull. The first part is the skull, second is clavicle, third we have rib cage, then we have spine, then we have hand bones, patella, foot bone, scapula, humerus, radius and ulna, pelvis, femur, and we have tibia and fibula. The skull has 29 bones altogether. They are going to protect the basically the important organs, that is most important organ of the body, that is brain. The skull is lined by some zigzag linings. So these zigzag linings, they are called as sutures. These are the different parts of the skull: frontal, parietal, occipital, temporal, zygomatic, nasal, maxilla, mandible, styloid process. All these are different parts of the skull. This is the frontal bone, zygomatic bone, nasal bone. This zygomatic bone is also called as cheekbone. The person who is very thin, the cheekbone can be seen. But if you are fat, you can just touch your cheek and feel that zygomatic bone. The only bone in the skull that is movable is mandible. Only bone which is movable is mandible, nothing else. After this, when I do the labeling of these all parts, you can easily do the labeling. This is nothing but frontal lobe, parietal lobe, occipital lobe. We have the temporal lobe. These are all nothing but they are sutures. This part is called as basically nasal bone here. Then here we have this zygomatic bone. The upper one is called as maxilla, lower one is called as mandible. And here you get sphenoid and ethmoid. So like that you can remember all parts of the bone in easy way of skull. When you talk about clavicle, it is the collarbone and joins the sternum. It is a part of the chest to the shoulder. It supports the arm and transmits force into the central sulcus. So look at this, this is how clavicle is attached. Now this is scapula and this is clavicle. Clavicle is also known as collarbone. If you see models, they have very straight clavicle, because in modeling world we say if your clavicle is straight, you are considered as the most beautiful. So if I say, look at this model, here you can see this is the collarbone, the clavicle. Now this clavicle is quite straight. It starts from the scapula and it comes and meets at the sternum. We have this clavicle, collarbone. Then we have rib cage. It protects the heart and the lungs and other upper organs. There are 24 curved bones. and the sternum runs down the middle. We have this part of the sternum. Their first part is basically called as manubrium. The second part is called as body, and the last part is called as xiphoid process. We have, this is the rib cage. Look at the ribs, how they are attached. So 1 to 7 basically they are called as true ribs. 8, 9 and 10 they are false ribs. 11 and 12 they are floating ribs because they are not attached directly to the sternum. And at the end we have xiphoid process. These are all costal cartilage. Whenever you are able to breathe in and out, the rib cage expands and it contracts, and it is possible only because of this costal cartilage. Expansion and contraction of the lungs basically helps in breathing. We have the next part that is called as spine. It is made up of 24 individual small bones called vertebrae. Your spine supports your head and body. Each of the bone they are linked by small joints. So there are lots of small bones present, vertebral bones. Look at this. So there is a cervical, which is present in the neck region, thoracic, lumbar. This area that you can see is nothing but it is the sacrum, and this area which is present at the last is nothing but the coccyx, or even it is called as the tailbone. The first one is the atlas, then we have axis, then other typical vertebrae. Look at this, it is not straight, it shows S-shaped curve. There are two curvature, one is in the cervical area, another one is the lumbar area. So our vertebral column is not straight, it shows the curvature. Atlas is the first one. The second one is the axis. Axis has a very special process called as odontoid process. And this odontoid process is responsible for articulation. So if I draw this odontoid, it goes inside and it is like this. So axis will extend in such a way that this odontoid process is quite visible. And then only the skull is going to move. Hand bones, there are lots of bones in your hand, basically 30. So we can say wrist, carpal, palm, metacarpals, fingers, phalanges. All these are your hand bones. So let's take it this way. This is clavicle, scapula, humerus. So clavicle and scapula together makes a girdle. This girdle we all call it as pectoral girdle. The humerus basically bone, the head of the humerus fits into the cavity of scapula. This cavity is called as glenoid cavity. Then humerus is there. Then we have the radius and the ulna present. We have carpals, 8 in number. Metacarpals, 8 in. Metacarpals are 5 in number, and phalanges total 14 in number. So this is hand bone. Phalanges, carpals, metacarpals. These are all the names of the bones. So we have ulna and radius. The bones of carpals basically are pisiform, triquetral, hamate, lunate, scaphoid, capitate, trapezium, trapezoid. These are all the names given. And we have metacarpals and the phalanges. So the last one, the finger is called as pisiform one. Let's talk about patella. Patella is nothing but the bone in your kneecap, basically. In front of your knee joint, it is present. It protects the knee. That is the role of the patella. Patella is something like this, where it has the apex. It is going to have the base, articular surface. Foot bone, there are 26 bones in your foot. They can make an arch shape to support your body when you stand up. So it is somewhat like this. So let's look at the bones, foot bones. There is very important one, that is heel, called as calcaneum, and there is cuboid. Talus, we have median, lateral, and inter. This is like median, lateral, intermediate, cuneiform bones, and there is a navicular bone. Then we have the metatarsals. Metatarsals basically will be 5 in number, and above that we have phalanges, which is total 14 in number. So these are the bones of the foot. This is how bones are arranged. Most of the time we have seen that the girls basically they wear a high heel. High heel will always create a problem for this bone because it will be in danger and it can easily break. So high heel should be avoided because the nature has not provided you in that way. So why to wear high heels? Just to increase your height for 2 centimeter or 3 centimeter, the bone comes under problem. Scapula is the triangular blade that is present, helps to movement of the arms and shoulder. So look at this. This cavity is very much important, that is called as glenoid cavity. Why I call glenoid cavity very important? Because humerus head is going to fit here and will form there. There is a coracoid process and there is an acromion process, and in this the humerus head is going to fit. Superior border, then medial border, lateral border. This is the front view, side view, and the top view. So these are different parts of the scapula. We have humerus, that is the hand bone again. So this is how it is going to form the joint. So if you look at this joint is nothing but it is ball and socket joint. This is humerus, hand bone. Radius and ulna, these are the bones in your lower arm. The radius is on the thumb side of your arm and the two bones swells each other. So they are going to rotate like this. So the big one, basically this is called as radius and this one you call it as ulna. So we have radius and the ulna. So look at this. This is radius. The radius, remember, it is always toward thumb side, and this is ulna. The radius and the ulna in between they have intrussus membrane. So this small gap you can see it allows the passage of the blood vessels and the nerves through it. The ulna has olecranon process. At the same time there is a trochlear notch and coronoid process present. We have the pelvis. The pelvis is shaped like a bowl. It holds all of the organ in the lower part of the body in slightly movable in nature. So this is the pelvis. But when I say pelvis slightly movable, remember it is movable only in female, not in male. So here the pelvic girdle basically is formed by fusion of three bones. Very first bone is ilium, then ischium, then pubis. So ilium, ischium, pubis together makes half of the pelvic girdle and remaining half. In between here there is a pubic arch and it shows the presence of pubic symphysis. This pubic symphysis is functional vessels movable only in case of female. Why? Because the female has to deliver the baby. So at that time the pubic symphysis is going to stretch a little bit so that the baby's birth can take place. So this is pelvic girdle. This part that you can see is nothing but it is ilium. This part is sacrum basically. And this part is also foramina, you can say, the opening from where the blood vessels will pass. This is called as pubis. This is ischium. This is pubic symphysis. What you can see here, the cavity called as acetabulum cavity, and this is the pubic symphysis area. So this area will stretch little bit at the time of delivery, at the time of parturition. Otherwise it is not at all functional in male. When we talk about femur, this is the thigh bone. It is the longest bone in the body and is one of the strongest bone. It helps to support your weight where you stand. So the entire weight of human body is holded at this place. Okay, now let's talk about this. We have ilium, ischium and pubis. And finally we have the femur, greater trochanter, lesser trochanter, shaft, lateral condyle and the medial condyle. Tibia and fibula. These bones are both in your lower legs. The tibia is the thicker shin bone and fibula is the slimmer bone. Look at this, tibia, fibula. You can see tibia very well but not the fibula because it's very thin bone. So this part basically is the tibia. This one is called as fibula. When you look at the x-ray, what is this? This is patella and this is the femur. So this is tibia. Remember one very important, that tibia is also called as shin bone. Other name for tibia is shin bone. Then we have fibula, fibular notch, lateral malleus, medial malleus, lateral condyle, medial condyle, and tuberosity, head of fibula. Like this you can remember. So this is the entire human skeleton having 206 bones, and these 206 bones makes us special. Because of these bones we are able to stand erect and walk. So this is all about human skeleton.